Okay, so with flossing, take an amount about this much, okay? We're wrapping this between our fingers and we're creating like a small area, beg your pardon, small area like this that we can basically use to access those areas. So you can use it between your index fingers like this, or actually between your thumbs. And basically the idea of this is that you want to be going between each tooth and you want to be flossing all the way to the bottom carefully with not too much pressure, but actually making sure that you're going to each crevice, both to the left and to the right of each space. It does take a little bit of practice to eventually get a technique to go through all the teeth. So for example, some of these teeth at the back can be a little bit more trickier, or at the top, but once you've done it a few times, it's actually quite easy to do. It should take you maybe an extra minute to actually do that. And some details on floss, we actually recommend to our patients, this is like a dental tape. It's a little bit more gentle, and unlike the traditional flosses that we see in the past, this is not a braided material, so it doesn't kind of shred between some areas in your mouth where those contacts are quite tight. So this is like a dental tape, really works very, very well. Superfloss is particularly useful for patients who have bridges or some complex crowns where it's difficult for traditional floss to be used, or for incidental brushes. And how this works is essentially they are individual strands, okay? So you've got like a sturdier area at the top, which is a little bit harder, okay? So it can facilitate the passage between teeth that are very close together. And then we've got an area where the floss is a little bit spongy. That's particularly good for cleaning. And then the third part, you basically got just like a conventional floss thread. So the way this works is, if, for example, we had a bridge on these front teeth, we wouldn't be able to floss in between, because these teeth would be essentially stuck together. So the way the superfloss is used, basically this is threaded underneath the bridge, and then this is actually pulled through, and we're able to then floss these spaces effectively, and then once you're finished, it can be pulled through afterwards. So this is superfloss, very useful, especially around implant work, around, for example, all-on-4 bridges, or bridges that are basically retained, where conventional floss doesn't get or hasn't got access because of the teeth are actually joined together.